Parkinson's disease, presented by Kara Evans, Emily Mayo, and Grisel Mendez. Parkinson's disease is a slowly progressive neurologic movement disorder that eventually leads to a disability. It is associated with decreased amounts of dopamine, resulting in destruction of brain cells. Parkinson's disease is the fourth most common neurologic disorder in the United States. There are 50,000 more cases each year. Parkinson's disease affects more men than women. Early onset can appear as young as 30 years old. However, most symptoms appear in the 5th decade of life. Some risk factors include genetics, atherosclerosis, oxygen-free radicals, viral infections, head trauma, chronic use of antipsychotic medication, and environmental exposure. Signs and symptoms include tremor, rigidity, bradykinesia, and postural instability. Symptoms usually do not appear until 60% of the affected neurons are lost and 80% of the dopamine level is decreased. Additional signs and symptoms are autonomic changes, including diaphoresis and orthostatic hypertension, psychiatric changes, including depression, mobility changes, including freezing phenomenon and the shuffling gait, and facial changes, including mask-like expression and dysphonia. There are 3 stages of Parkinson's disease. During the mild stage, movement symptoms do not affect ADLs. There are only slight postural and ambulation changes, and patients' concerns are dismissed by others due to vague symptoms. During the moderate stage, symptoms occur bilaterally, balance and coordination decline, and medication may wear off between doses and cause dyskinesias. Patients may seek help from doctor, family, friends, and support groups to help deal with their symptoms and stress. During the advanced stage, there is a gross decrease in mobility in which patients may even be bedridden for most of the day. They may not be able to live alone and may need to accept dependence from others.
Clinical diagnostic testing include patient history and the presence of 2 out of the 4 cardinal manifestations. Additional testing includes PET scan and SPECT scan.
Treatment is directed at controlling symptoms and maintaining functional independence. There is no medical or surgical approach to prevent the disease progression. Prescription medications for Parkinsonian symptoms include antiparkinsonians, anticholinergics, and other methods. Surgical procedures are used to alleviate symptoms.
Goals for enhancing quality of life include improving mobility, enhancing self-care activities, supporting coping abilities, and supporting psychosocial needs.
Safety measures include removing rugs, installing grab bars, appropriate lighting, frequent rest periods, and weekly home health aide appointments. Some tips for home care include identifying medication regimen, discussing fall prevention, and identifying resources such as American Parkinson's Disease Association.
Burdens of caregivers include depression, stress, financial concerns, and grieving support. Community supports include helplines, support groups, and local resources.